Okay. Make sure I've got it nice and set. And that one's going too?
Yes.
Did I move it out of view? Okay. Alright, so today we are using two different methods, so you'll see two different cameras for a little bit. We're going to do our third assessment. We're starting out with a person with a femur fracture. So the femur fracture, which is going to be lower on the leg, we'll go ahead and use this side. And then what you're going to notice is that you're going to be testing for everything distal to that. Can you move your leg in, just for funsies? Thanks. So you're going to be checking for sensation down here. You're going to be checking the capri fellow of the toes. You're also going to be making sure that you can wiggle your toes. Go ahead and wiggle those for me. Good. All right, so even though this is a compromise, we want to make sure that there is no ischemic changes down here as well. So you're also going to be checking for sensation. Can you feel between sharp and dull?
Yep.
All right, good. So we have good sensation down there. So what we would go ahead and do is splint the femur fracture, and then we would want to check the sensation, the cap refill, again to make sure that it was less than 3 seconds. Okay, good. Less than 3 seconds on each toe to make sure that you didn't wrap the splint too tight. Can you go ahead and wiggle your toes again for me? Good. All right, so the next thing that we're going to go ahead and go on to is the push-pull squeeze when you're checking for upper and lower extremities. Go ahead and push against my hands. Pull. Good, and squeeze. Good. Same thing with the blower. Go ahead and push and pull. And luckily he has everything equal bilaterally. So then what we're going to go ahead and do is the sensation test. So we're going to take our cotton tip, we're going to place it, go ahead and you see your toe, and you're going to place it at the bottom, and you're going to go ahead by the balls of the feet and check each one. Can you feel the sensation in each of those?
Mm-hmm.
If a patient could not feel that and they were a diabetic, that means they were starting to get some type of neuropathy and you need to be concerned about it. The next test that we're going to be doing is the tuning fork. What we do is we tap the tuning fork like that, and then we place it against the first metacarpal phalangeal joint. And if they cannot feel that sensation, then they are also having problems with their nerves. You can also test these against all other kinds of bony prominences by tapping the fork first and seeing if they can feel the vibration when touching each prominence. On the elbow, everything like that. Good. The next thing we're going to go to is checking for reflexes. When any of these reflexes are either hypo or hyperreactive, it goes anywhere from +1, 2, 3, and 4, then you have somebody who, if they're pregnant, they can have a magnesium problem. And if it's somebody who has been in a car accident or some type of injury, then you would be worried about any type of central nervous system problem. So the first one that we're going to be checking is the brachial. So you're going to have the patient kind of flex their hand, rest it against something. You're going to find their tendon, place your thumb over it, and tap. Good. All right, so the next one is going to be the brachioradialis. You're going to have the patient kind of drape over like this. You're going to put your fingers, or actually you're just going to locate the tendon that's running right here. And once again, go ahead and kind of keep it relaxed and up. Good. And you'll see one like that. The next one is going to be the patellar. So go ahead and sit up. You're going to want their feet dangling. We don't have a chair that dangles at this point. But what you're going to want to do is tap their knee. Good. And you'll see a movement of this when you do that. But just have them kind of dangle it. We're going to tap it. And then the last one that we're going to check, that we're actually physically going to check, is the plantar. So what you're going to do is you're going to take the other side of your hammer, and you're just going to go up like that, which as you can see has worked perfectly fine. I got a dirty look for that one. The ones that we are not going to be checking, because I'm pretty sure he would divorce me afterwards, is going to be the corneal, where you just take a wisp and you touch it against the corner of the eye so that you can make sure that it reacts, and then the gag reflex, which is good to check before you intubate somebody. All right, so that takes us to a close on that one. Next we're going to be going on to congestive heart failure. So the review of systems questions that I'm going to be asking him are, how do you sleep at night?
I usually fall asleep on the recliner.
Okay, why do you fall asleep on the recliner?
It's more comfortable and easier to breathe.
Alright, so that would be indicating that he can't sleep laying flat, which is usually orthopnea, something to be concerned about with CHF patients. Next question is going to be about fatigue. Do you tire easily? How are your activities as they used to be compared?
I get tired very easily.
He's remembering his cues. Alright, so if he gets tired very easily, this means that he gets more fatigued easily, which is another concern. And lastly, when you're sitting still, do you feel short of breath?
Yes, I do.
Alright, and this could also mean that his lungs aren't capturing what they should be. After that, we're going to do the review of what CHF symptoms look like. The first one's going to be JVD, which is, of course, the patient is laying at a 45-degree angle. You're going to check for the JVD on the side of the neck. This would be due to a backup of fluid from the right side of the heart. Next, we're going to take our stethoscope, and we're going to hear for the other two abnormal signs. So your first one is going to be rales in the back of the chest. So when they have a breathing, you're going to hear the rales. The next one is going to be the S3 gallop. So it's a little bit hard to hear unless you have training in it and you know exactly where to put the stethoscope. But it basically will sound like da-da-da, da-da-da, da-da-da. You need to just hear a little bit of a gallop at the very end to get some great YouTube videos for this. After that, we're going to go ahead and check for hepatomegaly. In patients with CHF who have very prominent, when you push right here, they're going to have tenderness upon deep palpation, and you're going to feel an enlargement of the liver. And then last, of course, is going to be pitting on the lower extremities. You're going to go ahead and put your finger on it and press, and if it leaves an indent, it's pitting. How long it leaves the indent tells you how bad the pitting edema is. Alright, and then last but not least, we're going to be doing some teaching. Alright, so Mr. Rausch, I understand that you just got diagnosed with congestive heart failure. I'm sorry to hear that, but this is a manageable disease as long as you help yourself out. So what we're going to be talking about today is diet. So I have a couple of things that I want to mention to you. Your activities, since you are getting more fatigued than usual, you need to be careful about when you exercise, because it is important to control your weight. So you're going to want to make sure not to exercise in extreme temperatures, like marathons in the desert, or the polar bear ice challenge, things like that you're going to want to avoid. The second thing is watching your salts and your water intake. Salts hold on to water. So avoid the canned food, avoid putting extra salt. I know that this is all hard to remember at this time. So I have a brochure, Christmas card, but a brochure, which is going to go ahead and tell you all about the diet. What questions do you have for me today?
I don't have any questions today.
Alright, and that concludes it for this visit. If they did have any questions, you could go on making sure that they feel comfortable. Some people learn by talking. Other people learn by having some type of auditory or visual stimuli. So it's good to give the patient a little bit of everything just so that they retain the information because you are going through a lot in a short amount of time. You also need to make sure that they have good follow-up visits so that they can keep track of their CHF. And then finally, you want to make sure that they know about CHF exacerbations. So, Mr. Rausch, when you start feeling more tired than usual, even right now, when you start feeling really short of breath, you need to make sure that you follow up with your doctor immediately, and hence you can even go to the ER for it. If you start coughing up pink frothy sputum, that's another sign of an exacerbation. So you're going to want to make sure to watch for that as well. Also watch for edema. We're going to be putting you on some medication, which we will go through and make sure that you know the side effects of. But also be aware that if you stop this medication, you can start getting fluid overload again, and you'll start having really bad pitting edema. If that happens, you need to contact your doctor immediately. And that's it.